Rifadin 600 mg intravenous solution is a medication that helps prevent and treat tuberculosis and other bacterial infections. It belongs to a class of drugs called rifamycin antibiotics and works by stopping the growth of bacteria. It's important to note that this antibiotic only treats bacterial infections and will not work for viral infections, such as the common cold or flu. Using this antibiotic when it's not needed can cause it to not work for future infections. If you are using this medication at home, make sure you follow the instructions from your doctor or healthcare professional. Before using it, check the liquid for any particles or discoloration, and don't use it if you see any. Make sure to store and dispose of medical supplies properly. The dosage and length of treatment will depend on your medical condition, weight, and how you respond to the treatment. It's really important to keep using this medication exactly as your doctor prescribed, and don't skip any doses. Use the antibiotic at the same time every day to get the best effect. Even if your symptoms go away after a few days, keep using this medication until you finish the prescribed amount. Stopping too early can make the infection come back. If your condition doesn't get better or gets worse, make sure to tell your doctor. Some common side effects of rifampin may include upset stomach, heartburn, nausea, or headache. This medication can also cause changes in the color of your urine, sweat, saliva, or tears, but this is harmless and will go away once you stop taking the medication. However, it may cause permanent staining of your teeth and contact lenses. Remember, your doctor has prescribed this medication because they believe the benefits outweigh the risks. Most people using this medication do not have serious side effects, but you should tell your doctor right away if you experience signs of kidney problems, mental/mood changes, unusual tiredness, easy bruising/bleeding, joint pain/swelling, or new or worsening shortness of breath. Seek medical help immediately if you experience chest pain or symptoms of liver damage such as nausea/vomiting, loss of appetite, stomach/abdominal pain, yellowing of the eyes/skin, or dark urine. Also, contact your doctor if you develop severe diarrhea, abdominal/stomach pain, blood/mucus in your stool, oral thrush, or a new yeast infection. While rare, if you notice symptoms of a serious allergic reaction like fever, lymph node swelling, rash, itching/swelling, severe dizziness, or trouble breathing, seek medical help immediately. This is not a complete list of possible side effects, so if you notice anything else, contact your doctor or pharmacist. Before using rifampin, make sure to inform your doctor or pharmacist about any allergies you may have to rifampin or other rifamycins. This medication may contain inactive ingredients that can cause allergic reactions, so it's important to talk to your pharmacist for more details. Also, be sure to tell your doctor or pharmacist about your medical history, especially if you have diabetes, liver problems, such as hepatitis, HIV infection, or a history of alcohol use or abuse. It's important to avoid alcoholic beverages while using this medication, as alcohol may increase the risk of liver disease. Rifampin may also affect the effectiveness of live bacterial vaccines, so be sure to inform your healthcare professional before having any immunizations or vaccinations. Before undergoing surgery, make sure to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, this medication should only be used when clearly needed. There is a risk of increased bleeding in both the mother and infant if this drug is used during the last few weeks of pregnancy, so it's important to discuss the risks and benefits with your doctor. Rifampin passes into breast milk but is unlikely to harm a nursing infant. Be sure to consult your doctor before breastfeeding. Drug interactions can affect how your medications work or increase the risk of serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Don't start, stop, or change the dosage of any medicines without your doctor's approval. Rifampin can interact with many medications, so be sure to tell your doctor or pharmacist about any changes in the medications you are taking. It can also speed up the removal of other medications from your body, affecting how they work. This includes certain anti-cancer drugs, antifungals, calcium channel blockers, and products used to treat chronic hepatitis C, among others. It's important to note that rifampin may decrease the effectiveness of hormonal birth control, such as pills, patches, or rings, potentially leading to pregnancy. Talk to your doctor or pharmacist about using reliable backup birth control methods while taking this medication. Additionally, rifampin may interfere with certain lab tests, potentially causing false test results. Make sure to inform lab personnel and all your doctors that you are taking this medication. If you suspect someone has taken too much Rifadin 600 mg intravenous solution and they are experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. It's important not to share this medication with others. Before starting this medication, you may need to undergo lab and/or medical tests to check your liver/kidney function, bilirubin, and complete blood count. Make sure to keep all medical and lab appointments. Remember, this medication has been prescribed specifically for your current condition, so don't use it for another infection unless your doctor instructs you to do so. Make sure to take each dose of Rifadin 600 mg intravenous solution Rifamycins as directed by your doctor. If you happen to miss a dose, speak to your doctor or pharmacist immediately to determine the next dosing schedule. Do not take a double dose to make up for the missed one. Make sure to consult the product instructions and your pharmacist for details on how to store Rifadin 600 mg intravenous solution Rifamycins. It's important to keep all medications out of reach of children and pets. And remember, do not flush medications down the toilet or pour them into a drain unless specifically instructed to do so. When Rifadin 600 mg intravenous solution Rifamycins expire or are no longer needed, make sure to properly discard them. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.